Hi, I'm Keltie Cheney and I'm a physiotherapist, and I'm going to show you how to do a median nerve slider. You can do this laying down, you can do this in sitting, you can ask your therapist what might be the best position for you, but just for ease of demonstration I'll do it in sitting. So you want to start with your elbow up like this, about a 90-degree angle. Your elbow is flexed, or your shoulder 90-degree angle, your elbow flexed and your wrist kind of in neutral. I like to start generally with a little bit of wrist extension. So it may be different, there's different ways of doing this, but the most common way is this way. You start with wrist extension and you slowly extend your elbow. As you're doing that, there's going to be an increase of stretch. When you start to feel the tension, at that point you don't push past, you flex your wrist. The tension should go away. You then bend your elbow back in. You can then rest if you want to, or you can do that a few times. So extending the wrist, slowly extending the elbow. When you get that point of tension, immediately relieve that tension by bending your wrist and then coming back in. You can challenge this a little bit, or you can do things a little bit differently, giving it a little bit of an easier tension point. You can, as you move, you can bring your head towards the side. But when you get that tension, you're going to bring that wrist back in, and then you can slide the head away from the arm as the wrist comes back in and the elbow bends. That's called a slider as opposed to a tensioner. So you're sliding that median nerve along its distribution. If that's complicated, don't worry about it. Just stick to the arm. You can also add in a tensioner. So you can actually increase it by bending the head away to start. You do the same movement with the arm. And when you get to that point of tension, again, you bring that wrist back in and you slide the head towards it. And then you go opposite. So that's more of a tensioner. Your therapist will let you know which one is the level that you're at and how many times. We generally will suggest you do it maybe 5 times or 10 times, maybe 3 times a day, maybe 5 times a day. It's kind of specific to the person, but that is just the visual. That's the speed at which you want it, and you don't want to push it past any amount of stretch. You want to get to the tension point and then relieve it immediately. You don't hold that tension. It's all about the slow, gentle movement, being aware of what you feel when, and then relieving it right away.